भारत में देखा देइथिबा कोरोनार डबल म्यूटांट समग्र विश्व पई चिंतार कारण। यह खूब द्रुत वेगर संक्रमित होतिबारु चिंता प्रकाश करिछि विश्व स्वास्थ्य संगठन WHO। आज एक सांबादिक सम्मेलन करी WHO कहिछि भारत में देखा देइथिबा कोरोनार नुआ रूप B1617 गत वर्ष अक्टोबर बेलकु चिन्हट होइतिला। तेबे रूप बदलाइबा परे मूल भूताणु अपेक्षा एहा अधिक द्रुत गति रे लोकंकु संक्रमित करुछि। सेहीपरि निजकु सुरक्षा देबा पई एही नुआ प्रकार भूताणु अनेक विकसित होई सारिछि। तेणु एहाकु समग्र विश्व पई चिंतार कारण बोली कहिछि विश्व स्वास्थ्य संगठन। तेबे WHO रो मुख्य वैज्ञानिक सौम्या स्वामीनाथन कहिसंती भारत रे देखा देइथिबा म्यूटांट विरोध रे समस्त कोरोना टीका प्रभावी होई परिबो। तेणु टीकाकरण को जोरदार करि पारिले एही भूताणुर प्रभाव विश्व रे कमा जाई परिबो।
My question is about the India variant and whether you are considering classifying it as a variant of concern and why.
Thank you very much. Dr. Maria von Kerkhoff, please.
So thanks very much for the question. I assume you're talking about the B1617 virus variant that was first identified in India. Indeed, this is one that has been classified as a variant of interest by WHO. Over the weekend and last week and into today, our EPI team and our lab team has been discussing with our virus evolution working group this variant, this B1617, and everything that we know about it in terms of transmissibility and any studies that are being done in India as well as in other countries where this virus variant is circulating. It is important to note that this lineage, this B1617, has 3 sublineages, the 0.1, 0.2, 0.3. I won't go into that level of detail. All of that will be provided in our SITREP tomorrow, where we will outline all of the information that we know about each of those sublineages. Having said that, in consultation with our virus evolution working group and our EPI teams and our lab teams internally, there is some available information to suggest increased transmissibility of B1617. There is a preprint that is out. So this is a paper that has not undergone peer review, and it's a limited number of patients suggesting that there is some reduced neutralization, and as such, we are classifying this as a variant of concern at the global level. There will be much more detail provided in our SITREP tomorrow around all of the available information that we have. What we do want to say is that even though there is increased transmissibility demonstrated by some preliminary studies, we need much more information about this virus variant in this lineage.
Thank you very much, Dr. von Kerkhoff, and now Dr. Sumya Swaminathan, Chief Scientist.
Maybe just to add very briefly to what Maria said, sequencing is telling us a lot more about this virus in real time than we've known in previous outbreaks. In fact, for many diseases, we really don't have this kind of genomic information that we have. So it's a good thing because we can keep up with the evolution of the virus, but we also need to take a balanced approach. And as Maria said, whatever the variant, the basic modes of transmission and the clinical illness remain the same, and the public health measures remain the same. We do know that the Indian government has a consortium for genomic surveillance, and that there are a number of investigations going on now on the B1617 variant that's looking at the both the transmissibility, the clinical severity, and also the response to the virus to antibodies that have been generated in people who've been vaccinated with the different vaccines that have been used in India, especially the Covaxin and the Covishield and also the Sputnik vaccine. And so over the coming weeks, there'll be much more data forthcoming. But, variant just on the genomics alone doesn't mean anything. It only tells us the story when we know the complete information, both on the clinical profile, on how it's spreading, the transmission, as well as on how it's behaving in the community in vaccinated and unvaccinated population. So it's really important to undertake those studies and to give enough time for that data to come in. But again, just to emphasize that as what we know now is that the vaccines work, the diagnostics work, the same treatments that are used for the regular virus work, so there's really no need to change any of those. And in fact, people should go ahead and get whatever vaccine is available to them and that they're eligible for.